You tell them we're good. Good afternoon, everyone. Good afternoon.
Good afternoon.
Thank you, Madam Vice Chair. Hi, everyone. We're about to begin. Good afternoon and welcome to the Health and Social Services Subcommittee of Appropriations Budget Bill hearings. Today is February 1st, and we will be hearing today from the Department of Disabilities, the Maryland Commission on Civil Rights, and the Department of Aging. Each of these organizations does an immense amount of work to serve constituents of all of ours across the state, and so we're honored to have each of you join us, plus a number of witnesses here to testify and provide their feedback on the budget requests. So we're going to begin, as we always do, with our DLS analysts report on the Department of Disabilities. Thank you.
Thank you, Madam Chair. My name is Natalie Andrade, and I'm here with the Department of Legislative Services to present the Fiscal 25 allowance for the Maryland Department of Disabilities. On page 1 of this analysis, you can see that the Fiscal 25 budget decreases by $1.1 million, or 8%, to $12.5 million. On page 3, Exhibit 1, shows the breakdown of the Fiscal 25 allowance. As you can see, 40% of the budget goes to regular personnel, 22% goes to the Telecommunication Access of Maryland program, and 5% goes to the Developmental Disabilities Council program, which is a federally funded program. Exhibit 2 on pages 4 and 5 shows the line item changes to the budget, and I'm just going to point out to the biggest changes. The first one is under personal expenses. There is an increase of $189,000 that reflects the addition of 2 new positions to support the Maryland Technology Assistance Program, as well as the Telecommunication Access of Maryland program. Under the TAMP program, there is a decrease of $1.7 million that reflects the reduced spending on caption and related telecommunication services to align with the expected decrease in traffic levels. Also, there is a decrease of $350,000 that reflects the end of some contracts related to the acquisition of assistive technology. Finally, there's an increase of $703,000 that reflects an increase of advertising and publication to encourage the utilization of the Deafblind Communication Facilitator program. On page 7 of this analysis, in the key observations section, there's a discussion that begins. There's a discussion about the USTA balance, the Universal Service Trust Fund balance, that generates revenues from the telecommunications surcharge across the state. And this balance supports the TAMP program as well as the Senior Call Check program that is administered by the Maryland Department of Aging. Also, here we have a list of all of the programs that are supported by the USTF. On page 8, Exhibit 3, shows an estimated service utilization of TAMP programs from fiscal 23 through fiscal 27. Maryland Department of Disabilities estimated a decrease of 43% in relay services usage. This decrease is mainly driven by a decrease in usage of teletypewriters and caption telephone devices. The Maryland Department of Disabilities attributes this decline in demand for relay services to a decrease in popularity of older relay services forms, coupled with the increasing adoption of more functionally equivalent relay services. Furthermore, the department reports that a next step will be to identify a transition path for teletypewriter users, toward more modern real-time relay services. On page 9, Exhibit 4 shows the estimated balance and revenues for the USTF from fiscal 23 through fiscal 27. The bars represent the revenue, while the line represents the beginning balance for all these years that had been estimated. At the close of the fiscal 23, the USTF initial balance was $10.9 million, and in the fiscal 25 allowance, the USTF expenditures for the TAM program decreased by $1.4 million compared to the fiscal 24 working appropriation. And this is consistent with the anticipated decline in utilization. Despite this reduced spending, the Maryland Department of Disabilities anticipates an increase in USTF expenditures, and that's why we observe a decreased trend in the line in the beginning balance line in Exhibit 4. So Maryland Department of Disabilities should comment on the areas of the USTF spending that are expected to increase in future years, driving the projected decline in USTF balance through fiscal 27. And to conclude, on page 10, at DLS, we have outlined a recommended action for the committees to take, which is to adopt a committee narrative requesting a report providing an analysis of the USTF expenditures. And with that, I conclude my presentation, and I'm happy to answer any questions that you have.
Thank you, Ms. Andrade. This is for a very thorough DLS analysis of the department's budget request. Do any subcommittee members have questions for a DLS analyst? Okay, seeing none, thank you so much. Really appreciate it. So we will now hear from the Department of Disabilities, and I will welcome Secretary Beatty, the Secretary of Disabilities, and Deputy Secretary Belcastro to the table.
Good afternoon.
Good afternoon.
I just want to make sure my team was seated here. Thank you, Chair Shetty and Vice Chair Jones and members of the subcommittee. I am Carol Beatty. I'm the Secretary of the Maryland Department of Disabilities. And with me at the table is John Brennan, who is our Assistant Secretary of Operations. You might know our Deputy Secretary, Lisa Belcastro, and then our Director of the Telecommunication Access Maryland Program, David Bahar. Also in the audience today, we have Assistant Secretary of Programs, Kim McKay, and basically we're all here to answer any questions that you might have. So I would also like to thank our DLS budget analyst, Natalie Andrade, for her very thorough analysis, and also she was a delight to work with, and we look forward to continuing our work with her. You have our written testimony. With your permission, I will discuss the issue that was raised by the analyst. We were asked to comment on the declining balance in the Universal Trust Fund, which we refer to as the USTF, and the anticipated expenses contributing to that decline. So I just want to say that in our opinion, the primary driver for the projected decline is the fee reduction that occurred in 2016. The Public Service Commission reduced the universal services fee from 11 cents to 5 cents. And this brought the annual revenues down from approximately $5.3 million to approximately $2.7 million. There have been some changes in how TAM dollars are spent. Most notably, the Maryland Relay Services have been reduced. However, there have been increased costs that are associated with the Senior Call Check Program and also salary increases and also associated fringe costs. Combined, these have hastened the rate at which the USTF surplus has decreased. However, the main reason for the projected shortfall in FY27 is the reduction in fees that occurred back in 2016. We are, of course, monitoring this fund carefully, and MDOD and TAM will make the Public Service Commission aware of any anticipated shortfalls well in advance. At that time, potentially necessary fee increases could be discussed. In closing, we concur with the operating budget recommended action to provide a report regarding the USTF expenditures, and we will coordinate with the Department of Aging, who operates the Senior Call Check Program, on that report. And thank you again, and we are happy to answer any questions that you might have.
Thank you, Madam Secretary. Do any subcommittee colleagues have any questions? Yes, Madam Vice Chair.
There we go. Thank you so much for being here today. I was wondering if you could provide any update on the work being done by the autism coordinator.
Yes, certainly. Thank you for that question. And I think we have the absolute right person here to discuss that because our Deputy Secretary has taken on the responsibility of transitioning the work from the Governor's Office of Community Initiatives to the department in July. And she's been very much on top of this, so I'll let her answer that question.
Thank you.
Thank you so much, Secretary, and thank you so much, Vice Chair Jones, for the question. It's wonderful to be here amongst our former colleagues, and we feel very honored to be standing up the work of the Autism Coordinator here in the Department of Disabilities. It did transfer over from the Governor's Office of Community Initiatives to our department in July, and I'm really happy to say we've hit the ground running. We've hired a wonderful coordinator, Victoria Rodriguez-Roldan, who is highly qualified for the position. She is an expert at the national level when it comes to autism strategy, and she is autistic herself, which is really important as we're working to stand up the very first statewide plan and strategy for autism within the state. So we're really excited about that. She's currently coordinating the subcommittees. Over the next 4 months, they're going to be working intensely to develop individual subcommittee reports, and that work will be used to inform her strategic plan that we are hoping to release in July. So thank you so much for the question, and we're really excited to do the work.
Thank you so much. This was brought to my attention by neighbor, friends, and constituents that were truly exciting, some of which attend the Harbor School. So I thank you so much. Thank you.
Thank you, Madam Vice Chair. Any further questions from subcommittee colleagues? Thank you. Sorry. Delegate Acevero.
Thank you, Madam Chair. Secretary, good to see you. Deputy Secretary, very good to see you. Question about a report. I know some years ago, the department had done a report on the disability state plan, I think for 2020 to 2023, right? We are in a new fiscal year. We're about to go into a new fiscal year. We're in a new year, 2024. Can you provide us an update as to the state plan for the disability community here in Maryland and what the department is looking at doing as far as like working with the legislature on that plan? Appreciate it.
Sure. Thank you for that question. It's a great question. We are in the process of revising the 3-year state plan, and we have been in both doing sort of internal analysis and as well as external stakeholder feedback gathering. We issued a survey which went out to lots of people, and we're starting to have that information come back in, and we'll be analyzing that as well. We project that we will have a new plan that will be then reviewed by the Interagency Disability Board, which is the board that sort of does the final analysis and then the final approval by July 1st. And I also want to give credit where credit is due. Our Deputy Secretary is also taking the lead on that as well and has done an outstanding job.
Planning at the department right now, and we're really excited to stand those plans up.
I just want to say I think that you all have an excellent Deputy Secretary and former colleague and friend, and it's always just really wonderful to get an opportunity to meet with your team and discuss the important work that you do. So thank you and everyone in your agency for the work that you do to serve our constituents with disabilities around the state.
Thank you so much.
Are there further questions? Okay, great. Seeing none, thank you so much. Really appreciate your testimony today. We do have a witness signed up to provide favorable testimony from the National Federation of the Blind, Anil Lewis.
Thank you. Wow. You should testify just to get the comfortable seats. It's nice.
You may begin when you are ready, sir.
Thank you. To the chair and the members of the committee, thank you. I really do consider this an honor to be able to testify today. My name is Neil Lewis. I'm the Executive Director of Blindness Initiatives for the National Federation of the Blind. We're a nationwide organization who proudly had our home here in Baltimore since 1978. Excuse me, I want to commend the work that's being done by Secretary Beatty and her staff. And I agree, I had the opportunity to interact with the Deputy Secretary when I was testifying on the Senate side. Phenomenal resources. I think Maryland should be very proud of the work that the MDOD is doing. Just to draw the point, as a nationwide organization, we interact with entities in every state across the country. So many times when you stand up an entity that's responsible for disability, they are a silo, right? That's where everybody goes to them. They create wonderful things for their citizens, and then they push it over to their disability group to say, now make it right for people with disabilities. That's just a flawed model. You see with the work that Secretary Beatty and her staff are doing, they're inculcating disability throughout the agency, which really gives you economies of scale and really results in true quality of life for me as a blind person to really interact in the world. So it doesn't create segregated lived experiences. It creates universally accessible experiences that are not only helpful for me, but also improves the quality of life for every Maryland citizen. Because even though I like things that talk to give me access sometimes, people who see also like things that talk to give them access sometimes. Just to highlight a couple of things, you have my written testimony, but just to prove the point about enculturating accessibility throughout, rather than supporting like post-secondary education instances where students with disabilities have separate services. We, through the collaboration with MDOD under the Non-Visual Accessibility Initiative grant, have also partnered with the Kerwin Center and the University System of Maryland, where we brought in the whole team that's responsible for creating post-secondary accessibility for students with disabilities. So the IT people, right, the Disability Student Services officers, the professors, and the administrators. And not only did we do that for several universities, their teams got together, and then they were also able to develop small communities of practice. So the IT at this university is interact with the IT person of this university, sharing those best practices so no one's actually having to create their own solutions in a silo. Again, building out that broader impact and creating economies of scale with respect to accessibility. So many other things I could highlight, but the other I would like to highlight is our accessibility fellows. In a report some time ago, it was demonstrated that the problems that we have with accessibility are not as tremendous as most people think, especially when we're talking about accessibility to the digital infrastructure, whether that be textbooks, websites, apps, etc. What's happening is the individuals that are receiving the training through post-secondary education are just not being taught that this is important and how to do it. We believe that accessible coding, meaning the coding and the developing that's necessary to create these accessible experiences, it's not an over-the-top, it's not an additional expense, it's just good coding. So when you teach individuals in that post-secondary environment who are going to be the future developers of tomorrow how to code, just teach them to code accessibly. And it's becoming more and more difficult to be inaccessible because the tools that are used are also forcing people to do things accessibly. So our Accessibility Fellows program that we coordinate collaboratively with MDOD and the University System of Maryland, we bring in professors, at least 3, from various universities or community colleges around the state, and we teach them how to enculturate accessibility into their curriculum. So not only are they creating an accessible experience for their students, as they're teaching these individuals, they're teaching them about accessibility and how to integrate it not only into their learning, but into their professional futures. So again, a lot of things to be proud here, and we, with the National Federation of the Blind, are just extremely pleased to be part of this work, and we hope that it can continue through the allocation of the Non-Visual Accessibility Initiatives grant. So again, thank you for your time and opportunity. Be happy to answer any questions.
Thank you so much for your testimony, Mr. Lewis, and for the important work that the National Federation of the Blind does across the country. We are fortunate to have you all based in Baltimore, right? That's where your national headquarters are.
Our pleasure to be here, yes.
Right here in Maryland. So we are very pleased to have you and welcome you to Annapolis today. Do any committee colleagues have any questions for our witness today? Okay. Hearing and seeing none, thank you so much, Mr. Lewis.
Thank
we
you.
Appreciate you. I just want to add, colleagues, that we have received written testimony in your bill file or in your floor system from the ARC of Maryland. So when you have an opportunity, please make sure to review that. So now the subcommittee hearing for the Department of Disabilities has concluded, and we will do the subcommittee hearing on the Maryland Commission on Civil Rights, welcoming back Ms. Andrade for the DLS analysis of the commission. Thank you.
Thank you, Madam Chair. Again, my name is Natalie Andrade, and I'm here with DLS to present the Fiscal 25 allowance for the Maryland Commission on Civil Rights. The Commission investigates claims of civil rights violations in the areas of employment, housing, public accommodations, state contracts, health services, and commercial leasing. Also, the Commission has work-sharing agreements with the U.S. Equal Employment Opportunity Commission, the EEOC, and the U.S. Department of Housing and Urban Development, HUD. On the first page of this analysis, you can see that the fiscal 25 budget increases by 12.5% compared to the fiscal 24 working appropriation to $5.3 million. As you can see, most of the Commission's expenditures are supported with federal funds, and additionally, the agency receives federal funds from HUD and EEOC to investigate claims related to housing and employment. The fiscal 25 budget includes one proposed efficiency appropriation of $90,000 that reduces the budgeted turnover in fiscal 24 based on lower than anticipated vacancy rates. On page 3, Exhibit 1 shows the breakdown of the fiscal 25 allowance. As you can see, almost 90% of the budget goes to personnel, which is the staff related to the investigation of cases. On page 4, Exhibit 2 shows the line item changes to the budget, and I'm just going to point out the two biggest changes. The first one is on the personnel. There is an increase of $484,000 that reflects a salary increases and associated fringe benefits. And the second one is an increase of $45,000 that reflects the implementation of a database that's designed to enhance case data tracking at MCCR. This new database is expected to facilitate timely reporting and enable MCCR to track trends that were previously inaccessible. On page 6, in the key observations sections, there is a discussion of the backlog of cases that the Commission has been carrying. On Exhibit 3 shows the civil rights inquiries and complaints that the Commission has received from fiscal 19 to fiscal 24. 24 is an estimation. And in fiscal 23, the total number of inquiries reached a total of 1,900 inquiries, and with a further anticipated increase in fiscal 24. This has influenced in the accumulation of cases pending an assignment to an investigator. So committee narrative in the 23 Joint Chairman's report requested that the Commission provide an update on the current backlog and open cases. And as of September 23, the Commission reported a backlog of 264 cases, all falling under the employment category. Within this backlog, 127 cases were originated within the agency, while 137 cases were transferred from their federal partners. On page 7, Exhibit 4 shows a detailed breakdown of the active case inventory by type. As of September 23, the Commission oversaw a total of 594 cases across a variety of case types. And as you can see, the blue bars represent the open and pending cases, And employment accounted for the largest share of cases at 59%, while housing represented 31% and public accommodation constitute 9%. Commercial leasing and commercial discrimination contract constitute less than 1% of the case inventory. Among these cases, the Commission identified 238 instances in which the case remained open beyond the 1-year mark. These are represented by the orange bars in Exhibit 4. And these represent also 40% of the current and pending inventory of cases. The Commission attributed open and pending cases beyond the 1-year mark to a significant backlog from 12 to 8 months earlier, estimated at around 700 cases that were pending assignment to an investigator. To alleviate this backlog, the Commission obtained additional approval for additional personnel, and from fiscal 23 to fiscal 24, the Commission received 5 additional positions to be assigned to the case processing unit. The agency also noted that as of September 23, there were no cases in an assigned status surpassing the 1-year mark. On page 8, Exhibit 5 shows the average processing times by case type. As you can see, the bars represent the average number of days that takes to process cases related to housing, public accommodations, and employment. The Commission utilizes internally established benchmarks, including a target of 180 days for matters related to employment and public accommodations. That is the black line. And also the Commission aligns with the HUD's benchmark of a resolution of cases within 100 days for housing-related cases. That is the red line. From fiscal 2019 to fiscal 23, you can see that the agency consistently failed to meet processing benchmarks for housing, employment, and public accommodation cases. However, between fiscal 22 and fiscal 23, the average resolution time for employment and public accommodation cases improved, decreasing by 58 and 200 days respectively. And housing cases experienced longer delays with an increase of 80 days during the same period. Regarding the processing time, the agency has noted that some factors impact the handling of cases. Among these factors, we have case complexity, staff resources, cooperation among involved parties, and the volume of documentation to be reviewed. The Commission reports that the most influential factor affecting the processing times and contributing to the case backlog is the availability of staff resources. On page 9, we have a description of challenges that the Commission has been facing in addressing the case backlog. The first challenge is related to retention and training duration. The agency noted that it typically takes 2 to 3 years for new hires with limited experience to become proficient in civil rights investigation work. And the Commission highlights the importance of having trained staff to efficiently complete the investigations. The second challenge is related to caseload size discrepancy. The Commission mentioned that best practices suggest that the desired caseload ratio in the employment investigation unit is between 30 to 40 cases per investigator. However, the Commission highlighted that their total employment case inventory leads to the assigned number of cases per investigator to consistently exceed this desired maximum. Another challenge is related to the impact of transferred cases from their federal partners. This has led to a significant rise in overall intake and contributed to the backlog. The presence of non-competitive salaries also pose challenges in retaining existing staff and attracting new talent. And finally, the Commission indicated an ongoing need for additional investigators to keep pace with the case intake. On page 10, there is a description of the recruitment and retention efforts. Committee narrative in the 23 JCR also requested the Commission to provide an analysis of employee recruitment and retention, specifically detailing tenure and reasons given for employees leaving the agency. The Commission report on recruitment and retention found that from fiscal 20 to fiscal 23, a total of 21 employees departed the agency, including 12 civil rights officers that are responsible for investigating the cases. Most of the departing investigators had a tenure of less than 2 years, and among the reasons cited for leaving, 9 employees reported pursuing another position within a state government, 2 employees retired, 2 did not provide specific reasons for leaving, and the remaining employees mentioned pursuing positions with the private employers, federal or local governments, or relocating out of the states. 10 individuals mentioned securing a comparable position. Finally, here we have a list of the implemented recruitment and retention efforts in 2022. Also, the Maryland Commission of Civil Rights should comment on any recruitment and retention efforts implemented during fiscal 23 and fiscal 24, and any initiatives planned in fiscal 25, including whether the allowance supports any new staffing initiatives. Furthermore, the agency should comment on the number of new investigators positions necessary to meet the preferred caseload ratio of 30 to 40 cases per investigator. Considering the low vacancy rate reported as of December 23, the Commission should discuss if there is a staffing plan in place to achieve this benchmark. And to conclude, on page 11, we have outlined our recommended actions for the committees to take, which is to request that the Commission incorporate updates on case backlogs and open and pending cases at the close of each fiscal year in its annual managing for results submission. And with that, I conclude my presentation. Happy to answer any questions.
Thank you so much, Ms. Andrade. Do we have questions for a DLS analyst on the Commission's budget? Okay. Thank you so much. It's a great, thorough analysis, as always. Thank you. So now we will call up our friends from the Maryland Commission on Civil Rights. I have listed Cleveland Horton and Alvin Gillard. And you may begin when you are ready.
Thank you, Madam Chair, and members of the committee. We say good afternoon, and we appreciate the opportunity to respond to the Department of Legislative Services fiscal year 2025 budget analysis. I'm joined by our Deputy Cleveland Horton, who oversees all of our case processing activities. We'd like to thank our assigned analyst, Natalie Andrade, for her thoughtful analysis. We know that this is her first experience, and we certainly thank her for her support and cooperation during the analysis. The staff of the Maryland Commission on Civil Rights continues to work creatively and consistently to respond to our most fundamental responsibility, and that is investigating complaints of alleged discriminatory behavior in a timely, professional manner. We're not yet where we hope to be, but we are making significant progress in the most critical areas of reducing the number of complaints in unassigned status and reducing the time it takes to complete investigations. We believe the Governor's 2025 allowance affords us the opportunity to continue the progress that we have made, so we respectfully ask for your support of this allowance, and we're happy to answer any questions that you may have.
Thank you, sir. Do you have words you'd like to share, or are you here for questions?
I'm here for questions.
Oh, great. Okay, thank you so much.
No problem.
Do subcommittee colleagues have questions for the commission? Delegate Acevedo.
Thank you, Madam Chair. Thank you. Good afternoon. Appreciate you all for being here and responding just to the DLS report. quick question. Have you all been noticing an increase in complaints or cases filed with the Commission on Civil Rights? Each year, do you all see like an incremental increase in cases? Is that something that you saw last year? Yes.
Thank you, Delegate. I'll defer, and Cleveland, you can respond.
No problem. Thanks, Delegate, for your question. We started to see a doubling in the number of cases that were coming into our agency around fiscal year 15 and 16. That level has continued to sustain itself. We continue to see slight increases, especially in employment. If we take a look at our annual report, kind of indicates how, just from a retaliation standpoint, we know that historically in the employment sector, race had been, for probably 10 to 12 years prior, the number one category in employment complaints. Retaliation for the last 4 years has been the top category in employment, and it continues to rise. So we are very concerned about that, because we know as a number of retaliation cases exist, we know that there are a larger number of individuals who are afraid to file complaints because of the possibility of retaliation. So we know, just overall from a complaint standpoint, that our complaints continue to slightly increase ever since fiscal year 2016, where we were receiving on average anywhere between 500 to 600 complaints. Now we are on average anywhere between 900 to 1,100 complaints per year, without the doubling in staff. So our agency, under Director Gallard's leadership, has really been trying to figure out efficient ways to manage the increase in cases that we've received, to make sure that we can process those cases in a timely fashion, which is why probably about 12 to 18 months ago, as the analysis indicated, that we had over a 700 case backlog. So we have been aggressively addressing that, but we do continue to see an uptick in the number of cases that we do receive in our commission. We are concerned, as the continued climate around hate continues to climb, that we do anticipate further increases in the number of cases that we receive at our agency.
Thank you.
Thank you so much, Delegate, for the question and for the thorough response. Delegate McCaskill for a question.
Thank you, Madam Chair. Thank you all for being here. My questions are around the backlog. So I noticed that it takes 2 to 3 years for a new hire to become proficient in handling investigations. Why is that the case?
Quick response, and then I'll defer to Cleveland as well. It's the complexity and the nature of the position. It's sort of a specialty type of investigation in investigating unlawful discrimination, allegations of unlawful discrimination. So the body of candidates from which you have to choose usually come with limited experience. So they're starting pretty much from ground zero. So you do have to train them, and there are limited entities that provide that type of training. Usually it's our federal partners, whether it's EEOC or HUD, or whether it's internal training provided by the Maryland Commission on Civil Rights under the leadership of our General Counsel, Glendora Hughes, who does a lot of the training, and also our Education and Outreach Unit. So it generally takes industry-wide 3 years for a new investigator with limited or no experience to become proficient. So for us, it's no different. I think actually we are seeing dividends probably earlier than our counterparts throughout the state and throughout the nation.
Yeah, and I'll just add to that, part of what we also saw from an agency standpoint was that we were bringing individuals in and not properly onboarding our staff in terms of from the necessary training to be proficient in the job. So we really had to take a step back to make sure, because we do take what we do very seriously. We know that each case is impacting the lives of some individual, whether perceived or real, from a discriminatory standpoint. So our agency has created a very thorough onboarding process. So our staff members don't touch a case for their first 6 to 7 months with our agency, because they're going through a very thorough training process to understand our law, our statutes, what governs our agency, the elements of proof. They're going through that training to make sure that as they're reviewing these cases and making the recommendations for the cases that we see at our agency, that they're doing so in an accurate manner. So you add the 6 to 7 months from an onboarding standpoint to then the practical side in terms of going through with their supervisors, getting the necessary training from a fact-finding conference standpoint to make sure that they can actually do the work before we actually put them in real-life settings to do the cases. Again, we just want to make sure that we're protecting the public and that when we are assigning cases to our newer employees, that they are fully prepared and trained to be able to assess those cases in the appropriate manner.
Thank you for the explanation. And my last question is, thinking about the budget and thinking about the DLS analysis, the DLS analysis notes that the commission needs additional investigators and an assistant general counsel. Is that in the budget?
We were successful in obtaining 5 new positions in FY23, actually came on board early in FY24. None of those positions are assistant general counsel, so we continue to make the ask. So it's our hope that if not in FY25, in FY26, we will be successful in bringing on an assistant general counsel. But we did bring on new investigators, which was sorely needed as well.
Okay, thank you for the explanation. Thank you, Madam Chair.
Thank you, Delegate. Just to clarify and make sure that we heard the answer to the delegate's question, it sounds like what you're saying, sir, is that you were successful in hiring some individuals and that you've made the request, but is the budget allowance for FY25, does that include money for the hiring of additional investigators or an assistant general counsel?
It does not.
Does not. Okay, thank you. I appreciate the clarity. Vice Chair, for a question.
Thank you so much, Chairwoman. And I want to thank you both for being here, but more importantly, for you and your colleagues in the critical, important work that you do. I'm so very appreciative, as well as my constituents in the state. This is hard work.
Thank you. Thank you.
So my question is on manual case tracking, page 5 of the DLS report. The analysis indicates that the prior federal database that had been used for case tracking were insufficient for the Commission's work and their use, and that as a result, all data requests are being handled manually. That's true?
That is true. So, and I'll clarify that for you. So we have been dependent upon the database with EEOC, which is called IMS, Integrated Mission System, through EEOC. All of our data from the cases that we receive would go into IMS. And we recently had the opportunity and the ability to be able to report out on information. So if you asked us the number of complaints we received in any particular area, we could go to the IMS system and report out on that data. Well, EEOC had the bright idea to change that system. They've now gone to an ARC system. They guaranteed us throughout the development of that system that we'd have the same reporting functionality as we had in IMS. That system rolled out on January 1st, 2023, and we have not had the reporting functionality since then. So we no longer are able to report out the way we used to based off of our information. So all of our supervisors, when there's needs for information to come in reference to trends, the types of complaints that we're receiving, the annual reports that we produce, all this information right now is being tracked manually by our supervisors. We are in the process of developing our own internal database so that we will no longer have the reliance of our federal partners or their databases to get our information.
So on that, just to be clear, when can we expect the new database to come online?
We're going through the development stage now. We anticipate that it should be up and ready by the beginning of the fiscal year, July 1.
July 1. And the 45,000 is the 45,000 going to be going towards, what's that going towards?
The 45,000 is for the completion of the development, customization of that database for our agency.
Thank you so very much.
Thank you.
Thank you, Chair.
Thank you, Madam Vice Chair. I have a question regarding appraisal bias. So I'm curious if the Commission has continued to receive complaints about appraisal bias for home real estate. So I know, or I'm also curious to see if the Commission is also considering promoting the new alternative pathway to appraisal licensure. Legislation was enacted last session. It only took effect in October, but with the State Commission of Real Estate Appraisers estimating that a significant increase in the number of individuals qualifying for licensure, do you see an opportunity for progress in addressing racial bias in the housing market, where we know that homes in Black communities are often undervalued by upwards of $48,000 per home?
Thanks for that question, Chairwoman, and that is a great question. So we are actually working, currently we have an MOU developed with the Real Estate Appraisal Commission. We have not signed it yet. We are in the process of signing that shortly, that we will partner together to make sure that all complaints of appraisal bias will make their way to the Maryland Commission on Civil Rights. Through conversations with that commission, we've uncovered that they do a great job of investigating complaints of appraisal issues, not necessarily appraisal discrimination issues. So we feel like by our two agencies partnering to make sure that those discriminatory appraisal issues are coming to our agency so we can address those issues directly, we feel like by entering into that MOU and that partnership, we will be able to do so. Housing appraisal, as you indicated, continues to be a concern for our agency as a concern for our state. And we do want to ensure from a Maryland Commission on Civil Rights standpoint that we are doing our part to make sure that we're helping mitigate those issues. We held a housing forum last year specifically around housing appraisals. We'll be doing another one in April around housing appraisals as well to educate the public, to let them know how we can be a resource to them if they feel as though they have been a victim of housing appraisal bias. And again, we're working with all of our partners who are embedded in this process of housing appraisals to make sure that we are included in every way when individuals raise concerns around housing appraisal bias.
Okay, thank you. And then just kind of related to that, does your commission have the capacity staff-wise to take on additional investigations given the case backlog issues that you've had? And I think often appraisal issues tend to be somewhat time sensitive. If someone is trying to qualify for a home loan in order to purchase a property in particular, making sure that those individuals are able to receive a timely response.
We do, because we have a dedicated housing unit, and the backlog cases are actually employment cases. So we believe that we're positioned to accept any increase in housing complaints. And also, Cleveland mentioned the upcoming training. We actually were successful in getting a grant from HUD to do exactly that, to do some communication and cross-training around the appraisal issue.
Terrific. Thank you so much for this really important work.
Thank you.
Any final, I'm sorry, Delegate McCaskill for a second bite? Okay, Delegate Heinbach.
Okay, thank you, Madam Chair. Thanks for being here. My question has to do with 2 to 3 year ramp up or train up before investigators can be productive. I'm just curious, what kind of background do you look for in applicants? Do you look for people that have some kind of legal experience or law enforcement or maybe military, or what do you look for, and what do you find that who you're drawing in to be investigators?
That's a great question, and we thank you for that question. I think that what we look for has changed over time, right? I know that previously we were looking for those with legal experience, legal backgrounds, individuals that have a high capacity to write very efficiently. But because of the salary issue that we've had over time, getting and retaining those individuals had been a very steep fate for our agency. We were able to attract them, but we weren't able to retain them. So we did have a very high vacancy rate, which I think was also indicated in our analysis as well. Really now we look for, and we bring most individuals in on our entry-level basis because we find that's the easiest way for us to get folks in the door and to retain them. Folks really who are, committed to civil and human rights and to impact that area, but also folks who do have some level of background around writing, investigating, and things of that nature. But we are really looking, top of the line priority for us are those individuals who understand and already have a background in what the civil rights and human rights issues are within the state. We can teach them how to do the job, but we want to make sure that they have that background moving forward and that dedication, because we know that as an agency, and we've talked about this typically every time that we come down and testify, that we know we don't pay the most. So the rewarding part about doing the work that we do is the impact that we're able to have on the lives of the communities in which we serve every day. And we're looking for individuals who are dedicated and passionate about having an impact on them and protecting the public within their rights.
And just to clarify, that 2 to 3 years, investigators generally become fully proficient, but that does not mean that they're not productive. Usually after that first 6 to 8 months, they start to produce, but just not at the levels that will impact our cases in unassigned status.
I assume they need a little more mentoring at that point along the way, so
Exactly.
it's kind of a distraction a little bit, I guess. But so retention, well, I hadn't thought about the writing skills, but that must be a critical component. It's hard to find
Absolutely.
people who have both of those skills. So
Yes.
But thanks for what you're doing, and thanks for answering my question. Thank you, Madam Chair.
No problem. Thank you.
Thank you, Delegate, and thank you for the thorough responses. One more bite at the apple, Delegate Acevedo.
Curious as to whether you all have done a salary comparison, because, localities, counties, in Montgomery County, we have an Office of Human Rights. I imagine there's overlap in terms of, investigation, the work that you all do, but your work certainly being a little bit more expansive. Have you all done a salary comparison? We're talking about recruitment and retention, and all these staff that are certainly critical to your agency's work, but have you all done a salary comparison with some of the local offices, particularly like in Montgomery County, the Montgomery County Office of Human Rights that do have investigators that handle a good bit of this?
We were actually successful in FY23 in that salary survey and review, and actually worked with the Office of Budget and Management, and we were successful in having all of our salaries upgraded across the board. So we've already started to see that we're better able to retain our incumbent staff, and folks are not seeking other employment. So we believe that probably in this fiscal year and into the next fiscal year, we will actually see our time and process numbers go down, and we will see that unassigned case status number go down, because folks are staying and they're becoming fully proficient.
Right. Thank you.
Thank you.
Thank you, Delegate. Thank you, friends, for sharing the thorough response. Has your question been answered? It's been answered. Okay. Thank you so much for your testimony today. Really appreciate it. I know the conversations will always continue, and we appreciate, again, the incredible work that
Just want to also thank this committee again and all members of the General Assembly as I transition out at the end of the month, retiring. Mr. Horton will be serving as our acting director, so I both invite and encourage you to reach out to him if you have any questions or needs. And it's certainly my hope that in moving forward, he will be afforded the opportunity to lead the commission. So thank you again on behalf of the entire staff.
Well, thank you so much for those kind words and for your service, sir. Congratulations on a well-earned retirement.
Thank you.
And we welcome the opportunity to continue our partnership. So thank you so much.
Great. Thank you.
Okay. Have a good afternoon. That concludes the hearing on the Maryland Commission on Civil Rights, and we will now continue on with the Department of Aging, welcoming our DLS analyst, Naomi Kimura, for the DLS presentation. Thank you so much. You may begin when you are ready.
Thank you, Madam Chair. Okay. My name is Naomi Kimura. I'm an analyst with the Department of Legislative Services. I'll be presenting the fiscal 25 budget for the Department of Aging. Beginning on page 1, you can see that the fiscal 25 allowance includes $90.4 million for the Department of Aging, which is a $3.8 million decrease from the working appropriation. Most of that decrease is driven by the expiration of federal stimulus funds, which I'll talk about in a couple moments. At the bottom of page 2, I wanted to highlight a couple of items included in the fiscal 24 budget bill for legislative priorities. The first is $1.15 million that the department received for one-time grants to the organizations listed in the bulleted list on that page. The department issues funding through reimbursements, and so each of these organizations on a quarterly basis submits a reimbursement request to the department, and then they pay out quarterly. So as of this writing, the department had paid the first quarter payments and is in the process of paying the second quarter payments. Because of that delay, the Department of Legislative Services has asked the Department of Aging to comment on efforts to work with these grantees to ensure that the full appropriation for those agencies is received by the end of fiscal 24. The second item that I wanted to highlight in the fiscal 24 budget bill was an additional $8.5 million enhancement in order for the local area agencies on aging to address high wait lists in the senior care program. I'll also be discussing the senior care program in more detail in a couple minutes, but it's a program that provides financial support and case management to older adults in Maryland, and it's administered by each of the 19 local AAAs. On page 3, the last thing I'll highlight here is the Task Force on Preventing and Countering Elder Abuse, which was established during the 2023 session. The Department of Aging must convene the task force, and the task force is required to submit an interim report December 31st of 2023 and a final report December 31st of this year. DLS has asked the Department of Aging to clarify if it's allocated existing resources in order to for this purpose, and also comment on the status of the preliminary report that was due December 2023. On page 4, there's a pie chart breaking out the fiscal 25 allowance for the department. The biggest chunk of funding is going towards state programs, including the senior care program. About $25 million is allocated to programs that are required by the Older Americans Act, which include home delivery, meal delivery programs and consumer protection programs. On page 5 and 6, Exhibit 2 shows the major changes between the fiscal 24 and the fiscal 25 budgets. Again, the total budget is decreasing by $3.8 million, and that change is driven mostly by the expiration of funding through the American Rescue Plan Act and the Coronavirus Response and Relief Supplemental Appropriations. That decrease of $8.2 million is offset slightly by some increases in federal funding to support programs required by the Older Americans Act, as well as $2.4 million, which is included in the Department of Aging's budget for the first time in fiscal 25 for the long-term care and dementia care navigation programs. This program was established in the 2023 session and includes an annual mandated appropriation of $2.4 million. So this is fiscal 25 is the first year that that's going to be included in their budget. On pages 7 and 8, we include a chart of the community service programs offered by the Department of Aging. I won't go through all of them. Again, if you look at the totals on page 8, you'll see a decrease between fiscal 24 and 25. Again, that's reflecting the expiration of federal stimulus funding that was used to supplement those programs. On page 9, we've included personnel data. In fiscal 25, the department has 49 authorized regular positions, which is 9 more positions than the fiscal 24 appropriation. DLS has asked the Department of Aging to comment on the function of those new positions. And then we also wanted to point out that as of January 1st of this year, the department had 7 vacant positions, 2 of which had been vacant for more than a year. And so we've also asked the Department of Aging to comment on its strategies to fill these long-term vacancies. Beginning on page 10 is our discussion of senior care wait lists. So like I said earlier, senior care is administered by all 19 local AAAs. In recent years, it's carried pretty high wait list numbers, and so that's why the fiscal 24 budget bill included enhancement funding in order to address those wait lists and enroll more participants in the program. On page 11, Exhibit 4 has a chart from looking at fiscal 23 data, the change between July 1st, 2022 and June 30th, 2023 in each of the local AAAs. And so during this period, in all but 2 local AAAs, participant numbers in the senior care program increased pretty significantly. And many of the local AAAs also were able to make some progress decreasing their wait lists. But overall wait lists in senior care in fiscal 23 increased by about 14%. Regarding the funding, the $8.5 million included in the fiscal 24 budget bill that I mentioned earlier, because that funding wasn't guaranteed in the out years, many local AAAs were hesitant to spend the entire appropriation, and so there is a planned reversion of $4.5 million. On page 12, this bar chart shows funding for senior care over the last few years. So between fiscal 22 and 23, there was an increase of almost $1.6 million. In fiscal 24, you can see that senior care was funded at $9.93 million, plus the $4 million enhancement after accounting for that planned reversion, and then it's level funded at in fiscal 2025. Because this program has received various levels of funding in recent years, DLS is recommending adopting committee narrative, requesting a report from the department on senior care participation in waitlists and the adequacy of funding. The next issue begins on page 13. It's just an update on federal stimulus funding. As I've mentioned a couple times, some of these funding streams have expired, leading to decreases in the level of federal funding in the department. The chart on page 14, Exhibit 6, shows the amount of money that's been expended in the Coronavirus Response Relief Supplemental Appropriations and the American Rescue Plan Act funding. The SRSA funding expired September 30th of 2023, and so as of January 8th of this year, the department reported that the local AAAs had expended 96.2% of that award. On page 15, that exhibit shows the spending of the SRSA grants by local AAA, and you can see that nearly all of the local area agencies on aging expended 100% of that award. I think Prince George's County had the highest amount of unspent funds, about $84,000. They said that there were some staffing challenges in expending all of those funds. And then on the next page, page 16, Exhibit 8 is a very similar chart, again showing the spending by local AAA, but for the American Rescue Plan Act funding, which expires September of this year. The data on this chart is as of August 2023, and so there's also, a bit of a delay in terms of looking at what's been spent so far. The final thing that I want to highlight is just a couple of new initiatives that were established in the 2023 session. So the first is the long-term care and dementia care navigation programs, which I mentioned has that mandated annual appropriation of $2.4 million. This requires the Department of Aging to establish long-term care and dementia care navigation programs in each of the local AAAs. Some of the local agencies already have this program. The Department of Aging is tasked with building these programs up where they exist, as well as collecting and managing data and submitting an annual report each October. The Department of Legislative Services has asked the Department of Aging to comment on the status of implementing this program so far. And then the final thing I want to note is the Longevity Ready Maryland initiative, which was established by executive order January 3rd of this year. This requires the Department of Aging to develop a multi-sectoral plan to care for older adults in the state of Maryland. So far, the department has reported investing $1.7 million in data initiatives and has an interim report due July 25th. DLS has recommended adopting committee narrative, requesting an update prior to the submission of that interim report to have an update on project spending and project goals. With that, I'll conclude. DLS recommends concurring with the governor's proposed allowance for the Department of Aging and adopted two pieces of committee narrative, the report on senior care funding adequacy and an update on the Longevity Ready Maryland initiative. And I'd be happy to answer any questions if there are any.
Thank you so much, Ms. Komura. We really appreciate the thorough analysis. Do any subcommittee colleagues have questions for our DLS analyst? Thank you. Such a great report and presentation. No question. Okay, thank you. So now we will welcome to the table our friends from the Department of Aging, including the Secretary of Aging and their team. Thank you. And you may begin whenever you're ready, and please introduce your team members.
Good afternoon. I'm Carmel Roque. I am the Secretary for the Maryland Department on Aging. I want to thank the Chair and the Vice Chair, who I understand has now left us.
Yes, I apologize. She
no.
has to testify in another committee on a bill hearing, but she will return.
Okay. And also the full Health and Social Services Subcommittee and Department of Legislative Services analysis, Naomi Okumuro, for her wonderful collaboration with our department and tireless work preparing the DLS analysis for today. I also want to introduce my team who's here, Deputy Secretary Jenna Crowley, CFO Michael Zomber, and Chief of Staff and Operations Pam Seidel. And they're here to answer questions as we go along. I also want to acknowledge and thank those present today from the area agencies on aging. So we have the local aging network representatives, some of them seated behind me, and it's always lovely to have them here so that we are able to present that we are, yes, the Department on Aging, but the network really is made up of the 19 area agencies on aging. Without them, really the service provision would not occur. So I thank them for being here today as well. When I testified regarding the Maryland Department on Aging budget a year ago, I shared the values and aspirations of our department. And the center of that is really making sure that the well-being of older people, their families, and their care providers are seen as urgent and critical across all of state government. And in doing that, we're hoping that the desired outcome will be that older people live lives where they are healthy, financially secure, socially connected, and purposeful. The fiscal year 2025 MDOA budget reflects and supports these values and aspirations. It also reflects the goal of being fiscally responsible while prioritizing the essential investments that support us fulfilling this mission. MDOA has taken an all-of-government approach to meeting the responsibilities of the department by intentionally engaging and in partnering with other state agencies. This will be critical to our success in the coming year, but in the years ahead as well as we implement the multi-sector plan. MDOA has taken a thoughtful and strategic approach to deeply understanding both the personal and the social implications of living longer lives. That's what we mean by longevity. And we all know that we are living in an unprecedented time where the demographics of our state reflect that we will very soon have fewer people under the age of 18 than we do over the age of 60. So we are aging personally and collectively. The overarching framework for all of our work is to plan and prepare for Maryland, preparing for a Maryland that will be longevity ready. A Maryland that is able to successfully address the challenges and opportunities of longer lives so that all of us can thrive and grow and no one is left behind. MDOA is the state designated unit on aging tasked with receiving federal and state funds and dispersing them to the 19 area agencies on aging and monitoring and reporting on their use to ensure that the funds are being used for the intended purpose, and most importantly, having the intended impact on the lives of older people, their families, and care providers. MDOA is also required to plan and advocate for older Marylanders and make recommendations to the governor to develop policy and legislation that promotes the well-being of older people. In order to fill these requirements, our budget reflects rebuilding the Maryland Department on Aging to be a 21st century state agency by analyzing the needs of the department and building capacity by filling vacant positions, redefining roles and responsibilities and positions, and identifying the need for additional positions. Building the organizational framework and capacity for planning, policy, legislation, and advocacy work has been a central goal of this past year and will continue to be as we move forward. Working on redesigning the Maryland Department on Aging state-funded, pre-Medicaid, long-term care services and support programs in collaboration with the Department of Health will also be a critical piece of work this year. We've received a technical assistance grant very competitively, and the Department of Health is working closely with us to look at our senior care program, our subsidized assisted living program, and our congregate housing program, which are the three key funded programs through the state, to find ways that we can make sure that they are efficient and effective and reflect current needs in the state of older people. And finally, we received our executive order from the governor, which is focused on us being able to implement the multi-sector planning process, the goal of which is to create a plan for Maryland, not just for the coming year, but for 10 years ahead. This is a very forward-leaning, long outlook. It is not specific. It's not our state plan on aging, which we do every 4 years. This is really a different process and has a different focus. And it includes looking at all of the things that will need to happen for Maryland to be prepared for the significant demographic changes that we're facing in the state. So I think that this budget supports reaching MDOA's goals for this year, and through the strategic and intentional use of our resources in collaboration with other state agencies and stakeholders, and using a whole of government approach, we feel that we will be able to be successful. Thank you again for your time and attention, and we look forward to answering any questions you might have.
Thank you, Madam Secretary, for all of the work that you and your team have done. I know you and I were able to meet during the interim to connect and talk about these issues. And personally, with an aging, I'm the caregiver of an aging parent who I moved from North Carolina to Maryland. So it's always really wonderful to learn more and dive in to the incredibly important work that we're doing here in the state to support our aging population. Are the team members that you have here for remarks or questions, or both?
Remarks, questions, and both. But I think mostly for questions.
Understood. Okay, thank you. I just didn't want to forget to recognize anyone who had prepared remarks. So we will then turn to our committee colleagues for questions, and I see Delegate Acevero has his mic lit. Go ahead, please.
Thank you, Madam Chair. Thank you, Madam Secretary, for being here, and to your team. I appreciate your testimony. I had to step out for a bit, but before I stepped out, I heard a little bit of your testimony that I agreed with, where you mentioned that wanted to ensure that those, particularly seniors in Maryland, are safe, secure, and socially connected, which I completely agree with. A couple of sessions ago, I had a bill on LGBTQ seniors, particularly LGBTQ Senior Bill of Rights. SAGE, I'm not sure if you're familiar with SAGE, right? National Advocacy Group around LGBTQ seniors. They rank states on how we do as far as taking care of LGBTQ seniors. Maryland's not really in the place where it needs to be. It's bad, actually. And so I hear you talking about plan for seniors. Want to support that. Can we talk a little bit more about what we're doing to ensure that LGBTQ seniors in the state of Maryland who experience discrimination, abuse, particularly in care, services, housing discrimination, LGBTQ seniors who are aging, how are we ensuring that they're able to age with dignity and place, and, as you mentioned, safe, financially secure, and socially connected, right? What's the plan for LGBTQ seniors in this overall plan you have here?
So the plan isn't in place yet. We are in the process of the stakeholder engagement phase, and we are just launching that. And that's where we have the opportunity to make sure that all of the voices are at the table and get heard. And so my hope is that as we begin launching the stakeholder engagement phase of our multi-sector planning, one of the areas that we'll be able to make sure that gets focused, and that we are actually talking to the people who we need to be talking to about the experience that they're having and what could improve, that's where that will take place. So it gives us an opportunity to bake into our plan, particularly as we address issues of equity and inclusion in the plan, and that's going to be central to everything that is written into this plan. That's a place where we can lift up, I think, those issues. For the department right now, one of the things that we recognized is that we were pretty silent about that population and that we could do some things right away. So we've started a landing page that's part of our web page for the department to begin to list resources and opportunities. I think that and now I'm just speaking about my prior experience and knowledge of SAGE. I think the work in congregate settings such as nursing homes around trying to educate and support and enforce equal rights, civil rights, is a wonderful starting place, but it's difficult to really get the traction that we always need. That was my experience as a CEO of a healthcare facility. So I think there's going to be some really rich and robust stakeholder engagement. I think it's going to lead to having the plan reflect all of Maryland, not just some of Maryland. That's one of our goals.
Appreciate that. You mentioned something really important around stakeholder engagement, and I completely agree. Does the department have an advisory group or a constituency group that it works with, reaches out to on matters of this when it comes to policy, the experience of LGBTQ seniors, whether it's in care, services, et cetera, in the state of, do you have a task force, an advisory group that you all work with?
So I'm going to just give a quick response, and then I will ask Deputy Secretary to speak a bit to the way the plan's going to be rolled out and the engagement. I think, so the immediate answer is right now we don't have an active group that's working with us on that. But one of the things I recognized when I was so fortunate to be appointed to this role was that our department, the Department on Aging, did not really have a robust policy legislative advocacy function, although we are mandated by statute to do that. It was sort of dormant in many ways. And so this past year, we've been building that function. That's been a really important part of the work, which is why we got to the point where we could have an executive order to take on this model of multi-sector planning, which has been designed by the Centers for Healthcare Strategy, and participate in that and get ready for what we think is going to make, in the years to come, a really significant difference in the lives of older people. So I'll let Deputy Secretary talk a little bit about some of the nuts and bolts of how that's going to be worked out, because I don't want to leave the impression that we only have a big idea about this, but we don't have a plan. It's all about having a plan so we can shape our destinies.
Yeah, thank you. Excellent and timely question, and we appreciate this opportunity to address the LGBTQIA plus community. And that is that we absolutely value the experience and the lived experience of LGBTQIA older people and those who care for them as well. And on a very granular level, the Older Americans Act sees this population as a special population. We will be developing our state plan on aging in 2025, and we as a state will speak to how we plan to serve and lift up this population. In addition to that, just this past year in 2023, our AAAs, our Area Agencies on Aging, many of whom are represented here today, spoke in their on their local area plans on aging around how they, on the local level, work with the LGBTQIA population as well. I would also like just to point out that some of our AAAs are SAGE certified, one of whom is here today. And what that is really speaking to a percentage of the staff who provides direct services to those who are served by the AAA are complete a certification. Lastly, what I will also say is that we have contracted with the Mental Health Association of Maryland, and we are providing Engage With training, and there is a curriculum that is specifically based around this population. So we are taking a very multi-layered approach and certainly increased voice and visibility around this very important population.
Thank you so much for the response. Would just encourage you all, well, I would, one, welcome the opportunity to work with you all, and connecting you with the various groups that represent our seniors. I think it's critical. Maryland's kind of ranked among states when it comes to like LGBTQ seniors, elder abuse, and their experience in this state, with some states that you wouldn't expect. And so would welcome the opportunity to work with you all on that and to see how we can, one, get off that list, and two, serve a population that's going to be, part of the group you mentioned, Secretary, right? This new demographic that we have to ensure that we're caring for. So thank you all so much, and look forward to working with you all. Thank you, Madam Chair.
Thank you, Delegate, and thank you for the thorough responses. I just kind of relatedly would like to ask if the department could please keep our subcommittee informed about any work group meetings that you have planned, so that we might be able to be prepared to support the initiative. As expressed by Delegate Acevedo, there's strong interest here in the committee in doing so. So thank you for that work. Delegate Heimbaugh for a question.
Thank you, Madam Chair. I might have a couple questions. I'll be fast. But thank you all for being here. First of all, thanks for what you do as a senior. I'm getting to appreciate more and more what you do as I get older. I'm not over the hill yet. I'm just getting close. So. But, you mentioned demographics, and I was glad to hear you mention that, because I don't think we pay enough attention to demographics. Mm-hmm. I had the opportunity to talk to you the other day about the demographics in my district, 1A, yes, where it's a stagnant, shrinking, aging population. So what you do and the services you provide are really critical. This is a basic question. I'm probably the only one in the room that doesn't know the answer, but when we talk about a wait list, are we talking about the wait list for a specific program or lots of programs?
First of all, thank you for lifting up and valuing demographics as a lens through which we look at better serving older people. I appreciate that. The wait list that we're referring to is the senior care program wait list. Okay. And this is something that we've been working on for multiple years. This is not a new issue for the department or for the state. And it is one of the reasons why in last year's budget, the legislature put additional funding in to try and help us support our area agencies on aging. I'm going to just, if I may, take the moment to say more than you asked. One of the things that we know is that the senior care program was created really before there were Medicaid waiver programs for home and community-based services. And so its original intent and the thought behind its creation now doesn't really fit with the reality of the models that we have to serve older people and the numbers of older people we need to serve. And so this is part of what we'll be working on with our technical assistance grant that we were able to secure with our health department partners. Because we recognize we really need to look at the whole model, understand how we can make the use of those funds more effective and efficient, and do that in partnership with the Medicaid unit. So these are pre-Medicaid state dollars. And really one of the things that we're hoping we'll be able to accomplish is better leverage the actual Medicaid funding that exists, because some of the people on the wait list are eligible for Medicaid-based home and community services. And we know that there are just incredible opportunities around this. And there will be a full recommendation we will get at the end of the technical assistance process. Those recommendations will be evaluated to be lifted up and be made part of the multi-sector plan that will then go to the governor. And this is where you know I'm not, didn't spend my career in politics. I'm going to just tell it like it is. What I am hoping for and looking forward to is out of that work we're doing to really look at that program and the other state programs, that we will be able to come up with recommendations that will in fact become policy and legislation. And so this is it's a multi-year forward-leaning process. And we are very optimistic about where we can get to.
Well, thank you. I assume the waiting list was as you described it, but the additional $4 million that's shown on page 12 and 20, I guess it's in 24 and 25, is it your anticipation that that'll go entirely to services, or will a big chunk of it won't go to administration and overhead?
Almost all of it is direct services.
Okay, and then there's a lot of numbers here. In a couple different places, it shows a loss of revenue. Like on page 5, it shows a reduction, I think, in Alzheimer's and Community for Life. And there's probably an explanation about why that money's being lost here that wasn't used in time or whatever. But you could save me a lot of math if you would just, overall, is there more money overall to take care of seniors than there was in the previous year?
With the loss of our the federal ARPA and other dollars, there's less money, but our state money is pretty level set. So we redirected some of it, and it's being used differently.
So the last thing I promised.
Yeah.
So that loss of federal money, the COVID and all that kind of stuff. So you don't. That's not going to have any adverse impact on you accomplishing your mission, doing what you need to do?
I think that we're going to be able to work with our other state agencies around programmatic opportunities and funding opportunities and really leverage those collaborations to get the work done that needs to be done. Okay. I do want to say that in the years ahead, as we roll out the multi-sector planning process and the plan itself, I anticipate there will be funding needs associated with that. But I do not have any specific numbers as of yet.
Thanks for your patience. Thanks for your patience, Madam Chair. I appreciate it.
Anytime, Delegate. Thank you so much. I have a couple of questions. You covered some of them, so thank you for that. So I want to talk a little bit about the reversion of funds in senior care. So I know we talked a bit about how the General Assembly appropriated $8.5 million last year to try and help address some of the challenges that local AAAs are facing in enrolling patients who are on long wait lists for these programs, and that about half of it is being reverted back to the general fund. but the governor's FY25 budget assumes just the reversion of more than half of it that was provided. And so just curious, now that we know that the program is going to be level funded as a result of the reversion, how will this help with addressing these wait lists that the locals are facing?
I'm going to say a few things and then I'll ask Deputy Secretary to fill in if she'd like. Pam, I'm not ignoring you. We're so very blessed to have such a senior person in our department who has all the history and the knowledge and the expertise we need to be successful. So, wait list. There are a couple of sort of system issues. One is with the wait list, the funding cycle for the state and then the local jurisdictions are not aligned. So frequently there is an issue with the budget being approved, the funding being available on the state level, and then flowing to the local jurisdictions, and they have a whole different cycle that they're trying to complete. It sometimes puts them 6 months behind actually having the money with permission to spend it. So that's one of the things we're looking at, that how can this be made better? The other thing that happens and has happened is that our local area agencies have really struggled with staffing, and you need staff to actually administer these funds. And so that has interfered with some of the jurisdictions being able to use them in the way they want. We're also recognizing, and this is part of the work that's already being identified with the Medicaid unit, is we need to scrub the wait list and understand who can come off the wait list and be served with other funding, and then we can better use the funding that's available. So I am anticipating that what's going to happen this year is that we're actually going to be able to use the funding, the $4 million that's been allocated for the wait list. In the best of all possible worlds, that money would not be restricted just to the wait list. Because for us actually to bring the wait list down, we can use that money to the people who are already receiving services. And so part of the challenge that we have and that we need to work through and try and sort out as this money is being distributed and used appropriately really is that because it's just for the wait list, it kind of narrows what we can do in terms of navigating that. I don't know, Jenna, did you want to add to that?
Sure, I would be happy to. I would like to just humanize what a senior care waitlist means, and that is to paint the picture of who a senior care recipient is. Generally speaking, it is someone 75, 80, 85 years old with a strong desire to remain in their community and in the setting in which they choose to age. And what that means is that oftentimes they need assistance with basic activities that you and I are likely able to do independently. And when I talk about that, I'm talking about getting up and getting dressed for the day, perhaps remembering to take medications, and even receiving assistance with taking a bath or going to the bathroom. And so what we do in senior care is we provide very minimal supports that are essential at a much lower cost than institutional care, such as nursing facility care, that generally speaking our Medicaid dollars go to. So I share that with you because I think it's really important that we understand who is actually on this wait list and that we're talking about people. And with that being said, wait lists are people who are eligible at the time of application. So this is not somebody who is saying, you know what, I might need this in a couple years, so let me get my name on it. That's not what it is. It's saying, I'm already struggling right now, and I recognize I need some assistance. And so with that being said, these wait lists are super fluid, right? We have people who have medical events that may lead them to different cognitive or functional impairment, that maybe they return to their community and then need a different level of assistance. And it takes a lot of assessment and care coordination to ensure that we're providing the right care, the right service at the right time. That takes AAA staff, and it also takes providers that require contracting and procurement, and all of these things are really time sensitive. And so our AAAs with one-time funding, with good cause and reason, have been very reticent to tap into those funds with the idea that, you know what, I'm going to have to take those away. And so, like Secretary said, being able to have those funds be sustained, and even just knowing that we have this level of funding going into 25 is really critical, and opens a new pathway for some of these supports.
That's really helpful insight. Thank you so much. I just kind of want to follow up because we just had last Friday a joint subcommittee briefing with the Public Health Subcommittee on HGO on the Home and Community-Based Services waiver. And there's so many interesting data points shared in that. But they too are suffering with a massive waitlist problem, and in their case, actually like funded slots that they are just struggling to get people enrolled. And so, a couple of suggestions that we heard and we talked about were, making sure that there is cross-department, cross-agency coordination on the use of technology like MD Think to periodically and regularly scrub the list to make sure that the people who are applying for these programs are actually, in fact, still in need of them, have not moved away, have not passed away. I think that would be an incredibly important thing to do in this program as well. I think they shared in the HCBS waiver context that it had not been scrubbed since pre-COVID. Just hope that the department and the local area agencies are able to coordinate and collaborate and use the technology available.
May I comment?
Please.
Thank you. We have a no wrong door system here in Maryland. Our AAAs operate what are called Aging and Disability Resource Centers. And what I like to think of, and we think of, is that the ADRCs are really the front door to those HCBS services that you're talking about. And so all of our AAAs are supports planners for the Medicaid waiver program. And so many of our AAAs actually are the people who are providing that case management, writing the plans of service, and things of that nature. They are also, and so to your point about coordination and collaboration, are responsible for helping get people on that wait list. And so we are particularly well-versed in the opportunities as well as the challenges that exist in our long-term services and supports system. And we are really excited by the partnership and collaboration that has already begun, and that long-term services and supports technical assistance opportunity that Maryland Department of Aging and Maryland Department of Health have entered into with advancing states. And I will tell you, we are already seeing shifts in the way in which we are doing business on the behalf of Marylanders.
That's wonderful. Thank you for that commitment and work. I have one more question, if I may, and then I will turn to Delegate McCaskill for the final questions of this hearing. So I have a question related to the long-term care ombudsman. Can you share a little bit about their work, particularly in light of the abrupt eviction of 53 residents at the Landing in Silver Spring and Colesville in Montgomery County last fall, following the sale of the assisted living and memory care facility to a multi-billion-dollar real estate trust. It's an in-the-weeds one.
That question, I'm going to say a few things about that. That question actually highlights some of the structural issues that are problematic for the way we fund and deliver long-term care services and supports. And something like that being able to happen is a result of the way that we do incent profiteering in the long-term care, particularly nursing home world. So what the ombudsman does, the ombudsman is not part of the regulatory and enforcement process, which is housed in the Office of Healthcare Quality in the Health Department. The ombudsman stands separate from that in the role of working to be sure that older people are protected who are in congregate settings. And so in those kinds of situations, the role of the ombudsman is really to be present and to ensure that older people through the process are protected. The ombudsman actually has no authority or control over whether it happens to begin with. So there is a lot of work that's happening right now in Maryland through the Planning Commission and through the our Committee on Quality of Care in Nursing Homes and Assisted Living to look at the fundamental issues around who is able to buy and operate a nursing home, how the survey process works, what are the enforcement opportunities. But the ombudsman's work is really to ensure safety, security, and well-being of older residents in congregate settings after the fact in an incident like that. I don't know if that answers your question.
It does. Thank you so much, Madam Secretary. And now Delegate McCaskill for the final questions of the hearing.
Madam Chair, so thank you for humanizing that wait list because actually that was going to be kind of one of my questions to help me see it a little better since I'm a visual learner. However, and what you just spoke to, Madam Chair, I was thinking about, which is kind of a different situation, but I want to get some more clarification about the Village of Augsburg over in my district did a transition or transitioning of ownership, and we're getting a lot of calls and concerns about what's happening over there, but I'm going to do some other follow-up with that. But my question is around the expiration of the ARPA funds, and I'm specifically referring to Exhibit 6 and looking at that explanation. So since we are, the data from the DLS analysis shows that as of August, only 19.8% of the funds, or 4.5 million of the 18.37 million awarded, has been spent. So I'm curious of, will the agency be able to spend the remainder by the deadline?
I am going to let our CFO have a few words here if he would like, and also Pam has some thoughts on that as well. But I would say overall that this is something that we are very focused on, because we don't want to miss out on funding opportunities. And so there's a lot of discussion about how, where, what, and when that's underway and has been for some time in the department.
Thank you for the question. Yes, it's a very important question. For that, I would say that, as you know, that the ARPA funding represented a substantial influx of funding. It, in a sense, has been a challenge for some of the AAAs to spend all those funds. We have been proactive about it in the sense that we have been meeting with our AAAs around the state to get a handle on where they are, being that we know that the funds are expiring September 30th of this year. We have been working, again, proactively to come up with possible one-time funding possibilities of uses of the funds, and many of the AAAs have been able to present plans to spend the balance of the funds before they expire. But for some, it will be a big challenge, and it is possible that they will not be spent. I would also add that ACL has left open the possibility of a no-cost extension. They haven't eliminated the possibility, and we've encouraged our AAA network to, in the event that they would not have the opportunity to spend the funds prior to September 30th, but at least to have plans in place to be able to spend those funds, and then we can present that to ACL in requesting a no-cost extension, to present that this is what we'd be able to do if we'd have some additional time to have these funds available.
ACL is our federal funder. I wasn't sure everybody was aware.
Thank you.
Pam, do you want to say something about the technology? Do you want to try and?
Sure. So, thank you for the question, Delegate, and for the opportunity to present this. With the ARPA funds, there is a percentage of the funding that stays at the state of Maryland to be utilized for administrative expenses at our level. We have a significant void in being able to collect data effectively and efficiently. We do a lot of that on spreadsheets, Excel spreadsheets. Yes, exactly. And that's getting the data from our local area agencies on aging. They have programs, they have systems that are set up to collect the data. We collect the data on an aggregate level, meaning it's we don't get the names of the constituents, we don't get the personal data, but we get the numbers of people who are served. And it's very difficult for us to leverage those numbers to tell our story. So one of the things we are looking at doing with our ARPA funds is procuring a statewide, or for our use, data collection system. We have difficulties with that right now because we've had this vacancy in our procurement officer position. That is one of our positions that's been vacant for a little over a year. I have been trying, along with staff members, to manage that procurement work, but it's very difficult to conduct a large procurement when you don't have a background in procurement. We are very close to hopefully hiring someone to do that work who is significantly experienced in state procurement work. So that's going to help us really lead off quickly. But in the meantime, we're also working with the Department of Information Technology. I have been in constant communication with them, and we're actually going to be having a meeting very soon to discuss the needs for this data system, as well as other project management tools that we could use at the Department of Aging. We have not kept up very well with technology in our department. We're a small department, but we're hoping to leverage this funding to bring us more current, more up to date. And then just as an aside with the ARPA funding, you always want more funding, but unfortunately we got a floodgate of funding at a very difficult time for spending during the pandemic. And our local area agencies were not only receiving the funding from our department, but they were receiving funding through the local government as well. And as we work with them to utilize the funding that is expiring first, there's just you hit a wall where it's very difficult to continue utilizing all the funding. We are working on that, as Michael noted, with our AAAs, and we will continue to do that. Because the last thing we want to do at the department or at the local area agency on aging, give money back. We don't want that. So thank you. I hope that helps.
It does. Thank you, Madam Chair, and thank you for that, because hopefully you can absorb that funding, especially when you are thinking about enhancing technology. All the best to you. Thank you, Madam Chair.
Thank you, Delegate. Thank you, friends at the department, for answering the question. And seeing no further questions for you, thank you so much for your presentation. I hope you have the opportunity to stay. We do have some witnesses who have signed up to testify, and I think it's always great to have an opportunity to hear from them, but I recognize that your time is limited, as is ours, so thank you so much for that time. So we now have, let me see, 1, 2, 3, 4, 5 individuals, I believe, who have signed up to provide oral testimony. I will call, if you could just raise your hand if you're here. I see Ann Seco, Megan Peters, Tammy Bresnahan from AARP. Nope. Okay. So then Patrick O'Malley. Great. And Carol Lionhard from the Maryland Senior Citizens Action Network. Great. Okay, so those of you who raised your hands, please come to the table, and we will begin with Ms. Seco, if we can, and then go down the line accordingly. Thank you.
Thank you very much. Madam Chair, members of the subcommittee, I'm Ann Seacott, and I'm here today representing the Maryland Association of the Area Agencies on Aging. Those 19 AAAs that serve your constituents, providing a great deal of confident services to try to keep people in the community with dignity and as much independence as possible. We are here in full support of the governor's proposed budget. We are very grateful for the work that we've been able to do with the secretary and her entire team. It's been wonderful to collaborate and see some of the changes that are happening and the plans that are being made. We absolutely are thrilled that $4 million of the funding for the wait list is now built into that budget. And just as you all had just been saying, we're very grateful that the legislature put the $8 million in last year, and knowing now that a good chunk of that is going to be ongoing, it now gives confidence to the AAAs to go ahead and start people in services. There was absolutely, as was said, hesitancy to start people in services if there wasn't assurance that the money was going to continue and therefore the services continue. So they are now certainly, with this budget and, being optimistic about approval, starting to I think, get back to trying to use as much of the fiscal 24 money, knowing that it'll be there for 25. So we're thrilled with that. We are also very supportive of the $2.4 million that was put in the budget related to the long-term care and dementia navigation program. We are thrilled with the Longevity Ready Maryland initiative. It's about time. My hair was not this color when we started here in Annapolis talking about the gray tsunami, how much the aging population or the older population was just going to continue to grow. It is so wonderful now that we're really doing this across the board look at a plan moving forward. And we are also very supportive of the additional staffing that the department's able to get. So we are very happy with this. We ask for your support, and thank you. Oh, I'm sorry, I forgot to mention, it was mentioned before, some AAAs are here. Those from Anne Arundel, Hartford, Howard, Montgomery, and Prince George's County were able to make it today.
Good afternoon, Madam Chair, Vice Chair, members of the Budget Subcommittee. My name is Megan Peters. I am the Director of Government Affairs for the Alzheimer's Association, and happy to be in front of you today in support of the Governor's budget for aging. Maryland has made many strides in recent years advancing efforts to support the more than 110,000 Marylanders living with Alzheimer's and nearly 250,000 caregivers. And we thank this committee for their recent support in past sessions on budget initiatives such as funding the state plan on Alzheimer's last year and the funds for the wait list. And we are pleased by the budget this year and the inclusion of the $2.4 million for the dementia care navigation, long-term care navigation programs. The funding is important now more than ever, not only because of our growing older adult population, but there was a recent population-based study released earlier this past year showing that they project Maryland to have the highest estimated prevalence of Alzheimer's among adults 65 and older in the nation. So just a wonderful time to keep the momentum moving forward. And we're excited to see the department's commitment to this program. I know they've already hired a staff member to help roll this out, so we're really excited to be working with them in the year and years ahead on this program. So looking forward to supporting this, and thank you for your support.
Okay, good afternoon, every one of you. My name is Carol Leinhard, and I am the retired director of the Harford County Office on Aging, and my counterpart is with us today, Karen Winkowski, and I am the past president of the Maryland Association of Area Agencies on Aging, and currently I serve as the co-chair of MSCAN, which is the Maryland Senior Citizens Action Network. And I'm here today, you have my written testimony, and I just wanted to highlight a few things. We've been spending a lot of time talking about senior care, and what I wanted to sort of point out is that as legislators, you probably hear a lot of complaints about what it costs to provide government services. But in the case of the Maryland Department of Aging, their programs are very much designed to save money by keeping seniors independent, healthy, happy in their communities instead of in nursing homes, which are shockingly expensive. $120,000 a year for nursing home care is the current number. And I just think about how an average middle-class person, if they had saved $100,000 for their retirement, they would think they had a lot of money. But if it costs $120,000 to be in a nursing home for a year, their money is wiped out in a year. And so when we look at programs like senior care, for example, that helps to save money, then it also saves the state money. If we're using senior care as an example, and we talked a lot about the waiting list. In my years in the Aging Network, the senior care program had sort of an average waiting list of 2,100 people. And of that 2,100, pretty consistently 150 of those folks would go to nursing homes while waiting for services. Well, if you do the math on today's numbers, putting just those 150 people in nursing homes costs the state $18 million. But senior care has an average of $7,000 for a service package, and that's average across the state. $7,000 for a service package that keeps people out of a nursing home. And if you looked at the entire waiting list of 2,100 people, you could serve all of those people for $15,000 and still save the state $3 million. So we're talking about bang for the buck here. And I think that it's important to look at that. The good news, as we've talked about this afternoon, is the fact that the governor has put $4 million in the senior care program. So that's good news because we can use that to save money. We're looking at taxpayer money that's being saved. And there's more good news in terms of the governor's budget for 2025, which everybody has talked about. We're hoping that this leads to the local area agencies on aging to be able to have local flexibility because every one of those senior care packages is designed with one individual in mind. So their package of services saves them from nursing home placement. And all of this saves the taxpayers literally millions of dollars. And another cost-effective program is the Congregate Housing Services Program. We don't hear that much about it, but it costs about $3,000 a year, and it's provided for people who live in apartments, and it can provide a meal or two a day. It provides some chore service to help those folks stay in their apartments, and it costs $3,000 a year to provide Congregate Housing Services for a client. Today's dollars, it's $10,000 a month to put someone in a nursing home. So we can serve 3 frail seniors in Congregate Housing Services for the cost of 1 month in a nursing home. So when I try to lay out for legislators, you guys are in charge of the money, and I try to lay out how we save the money through these programs in the Department of Aging. But more than that, if you asked a person in a nursing home, you walk around and you ask, all of them would say to you, I want to go home. And if we can use these funds to help people stay in their homes, that's not just saving money. It's a wise investment of your money because it actually saves more. So I really thank you for the opportunity to come down today and talk to you about this program, and to thank the governor for providing the budget, and to thank each of you for preserving that budget, because you guys are in charge. Thank you so much.
Thank you so much, panelists, for your testimony. Mr. O'Malley, are you coming to testify as well? Okay. Wait, I'm sorry. Before you depart, does any subcommittee colleague have any questions for the panelists? Okay, thank you so much. Welcome.
Good afternoon, members of the subcommittee. My name is Patrick O'Malley. I'm a resident of Anne Arundel County. My story is, this past September, I was swimming in Ocean City, Maryland, and had a wave drill my head into the sand, which caused some pretty serious damage. I have broken vertebrae or had broken vertebrae and a spinal cord injury, which has me the way you see me today. I was flown to shock trauma and was there for 8 weeks, and then transferred to their related Hernan, their related rehab facility. I'm here in support of the medical equipment reuse program because it allowed me to, while I was in all those places for 13 weeks, I would have been there longer had this program not existed. I had the wrong kind of health insurance that didn't include my ability to acquire this chair, a hospital bed, and an electric lift to get me from one to the other. Ian and his team do a great job, and I'm just so appreciative of the program. Please support it. Thank you very much.
Thank you, Mr. O'Malley, for coming down here today and sharing your story. I'm grateful to hear that the program has been of benefit to you, and as it is to many other Marylanders, including some of our colleagues here in Annapolis, have utilized it periodically as needed. And so thank you. I know it's very difficult sometimes to come down to Annapolis in the best of circumstances. And I'm sorry to hear of the injury that you shared, but also grateful to hear that shock trauma was able to be there to support you when you needed it. This is another priority of the speaker this year, is to make sure that shock trauma receives the funding that they need. So thank you. Do any subcommittee colleagues have questions for Mr. O'Malley? Thank you so much for being here, sir. Thank you so much. I'm going to just ask one more time if Ms. Bresnahan from AARP Maryland is here. Okay. Thank you for that update, Ms. Lionhard. Really appreciate that. So, colleagues, I just want to draw your attention to the fact that in addition to Ms. Bresnahan's written testimony that is in your bill file, or excuse me, in your floor system, we also have written testimony from 4 others, the JCRC of Greater Washington, the Maryland Durable Medical Equipment Reuse Program, Baltimore Jewish Council, and Jason Brathwaite, who I believe provided testimony in his individual capacity. So please take an opportunity to review it, and you should be able to find that in your floor system. Thank you all for joining us today for this subcommittee budget briefing. We really appreciate all the important work that all of you are doing and all of your advocacy. This meeting is adjourned.